Amanda Kinsey was just 35 years old when she was diagnosed with stage 4 breast cancer. She is a loving mother, a devoted daughter, a loyal friend. And she's also the manager of care coordination at Benefis. She discovered a lump while performing a self-exam. That discovery propelled her on a care journey that has taken her through 20 different departments across the health system. Her gratitude and the actions by many Benefis employees are the inspiration behind this remarkable moment.
I did a self-exam and I found a lump in my left breast, and I kind of sat on it for about a month, and then it became painful. So I decided I better make an appointment with my primary, who's Kelly Timmer, the most wonderful primary in the world. And she is extremely thorough as far as, cancer, self-exams, that kind of thing.
She first came to me when she was 12. Her mom brought her in for medical reasons. And so we date way back till then. And then I've taken care of her ever since then. So we've been through a lot together. Amanda has high risk because she has multiple family members with breast cancer. So she was in high risk screening anyway, which prompted us, as soon as she had a lump, to be more aggressive with it.
When we first met with her, we actually felt some lymph nodes underneath her arm, so that was concerning. At that point, we felt she had at least a stage 2 breast cancer. But as we took more history and examined and did a few more tests, including a PET scan, it confirmed that the pattern was really a stage 4 presentation.
From there, it was kind of a whirlwind of appointments. Started with Dr. Martin, and then they ordered a PET scan. And I think you go into those obviously hoping everything's going to come up negative. It's going to be stage 2, which wasn't the case with mine. And I have lymph nodes that crossed over to my right side, which makes it stage 4. So that was a hard day because it was very surreal. And then from there, it was, I got to do what I got to do. I have a daughter. I want to be there when she graduates high school. I want to be there when she gets married, has her own kids, and that's sort of my motivator. Because it was stage 4, we decided to do chemo first.
In general, stage 4 breast cancer is not curable. Her particular story and her pattern of spread is one that we approached a little differently. So she was treated very aggressively with the intent to cure. She actually has had a combination of things, including chemotherapy, multiple surgeries, and has completed radiation therapy. And over the course of this, I've really gotten to know her as a person. She's been a real trooper. She has got a young child at home, a very supportive family who was with her at every visit, and did her best to work through her treatments, even though she clearly did not feel well as we were treating her.
For her to be so diligent about her screening, even though she didn't really have to be. She did because she just cared enough about her own daughter and her own health, and she had a nagging healthcare provider that just said, you have to do this.
Your primary care, you should have trust in them, and I go to her even if I have a bad cold. So she's just somebody that I go to and I trust her, and starting sort of this post-remission cancer journey together as well, and I'm just thankful she can be a part of it.
Early detection is huge in her case. She was at advanced stage, and had she not picked up and done self-breast exam and found that lump, we'd be in a whole different place right now.
So I'm thankful that I'm a part of Benefis when this happened. The people around me have been so supportive. I think of not only my family, my friends. It's a great feeling to be able to know you can count on the people you work with and the people that you surround yourself with Monday through Friday. I am a part of Benefis, and it's a family to me, and I've touched so many different departments and people, and everybody has been so wonderful. I think of Kelly Timmer's office, and Marie and Danielle and her staff, Dr. Martin's office, and Sue and Jesse and all of the infusion nurses, and then my surgery and getting to work with the OR staff, Kim and Lori in pre-admission, and Peggy Bleskin, and having to then go through that surgery and be up on the labor and delivery unit, and from the lab people to the nurses to the people who brought me my breakfast, and how wonderful everybody has been. And
when you have an employee that's a patient and you see what the beauty of the Benefis family is, just surrounding them with love and care, it's pretty neat. It's pretty neat to see that family all come together and just take care of each other.
I think it says a lot about Benefis and the support we give each other. If a person can ever repay the kindness that has been given to me, other than saying thank you and just continuing to pay that forward.
To see individuals like her that will go through this treatment feeling that poorly and still come out with a positive attitude is just amazing in my mind.
I'm just humbled. She's an incredible human. She's an incredible person, and she's an inspiration to me. What an amazing gal. That's all I can say. Incredible.
After that first round of chemo, I sort of feel like I can do anything. My future is moving forward and enjoying the experiences that I can with those that love me and that I love, and just every day moving forward.